Hello, everybody. Welcome back. This is Ricky, the heart pharmacist. It's been a little bit, a couple months, almost a year, I think, since I last made a video. A lot of stuff has been going on in my life. If you look around, you can kind of see a new space, which is exciting. But with everything going on in my life, I want to get back to making YouTube videos. It's something that I enjoy and kind of get back into the swing of things. And so today is very impromptu, kind of off the cuff, just kind of wiping off the rust, so to speak. And I want to continue the medication of the month series, which I started, which, if you need a reminder, is a series where we go over a cardiology specific medication that we use pretty often here in the United States. And as I was thinking of a topic for this week, I settled on a medicine called Apixaban, which is the brand name Eliquis. And I am sure just about everyone has seen an Eliquis commercial at some point on TV. This is a medication that we use very often in cardiology. And so I want to spend a couple minutes just make sure we understand how it works, how to take it, and so on and so forth. So without further ado, let's get into it. All right, so again, we're talking about Apixaban. That's the generic name. The brand name is Eliquis here in the United States. This falls under a class of medications which we call direct oral anticoagulants. This is abbreviated DOAC, D-O-A-C. Way back in the day when they first came out, they also called them novel oral anticoagulants or NOACs, but that term has more or less fallen out of favor. There are a ton of reasons you might find yourself on Eliquis. Just to name a few indications, we have some really weird heart rhythms, such as atrial fibrillation or atrial flutter, where there's a higher risk of stroke when you're in that heart rhythm, and we give you Eliquis or Apixaban to prevent that. We also use Eliquis in people with venous thromboembolism. So this could be someone that has a history of a pulmonary embolism, which is a clot in the lungs, or deep vein thrombosis, which is a clot in the lower extremities. Some people, particularly those with very advanced heart failure, might also form clots in the actual chambers of their heart, specifically their ventricles. We call this a left or right ventricular thrombus, and we may even use Eliquis in this situation. Beyond that, we also can use Eliquis in people that have certain lower extremity arterial disease. So we call this peripheral artery disease. So as you can kind of tell, we use this medication a lot. For some interval history, the first anticoagulant or blood thinner that was really out there was a medicine called warfarin or Coumadin. A lot of people used to be on this medicine, or you might even know someone that's on it. And this is the medicine where you have to go into a clinic, get your blood drawn every couple weeks, and make sure that your numbers, your INR, is normal and at a good level for the indication for treatment. What's really nice about Apixaban is that that blood testing to see what level your blood thinning is at does not exist, and we'll get into that a little bit later. From a dosing perspective, the dose does differ based on the indication for treatment. When we talk about atrial fibrillation or atrial flutter, the typical starting dose is 5 milligrams twice a day. This dose can be reduced to 2.5 milligrams twice a day if you meet 2 of 3 criteria, which I've listed up here on the screen. These are criteria looking at kidney function, your age, and your actual body weight. If you're being treated with Apixaban for venous thromboembolism, so again, clots in the lungs or the lower extremities, you typically will start with a loading dose, which is a higher dose of 10 milligrams twice daily for 7 days, followed by your maintenance dosing of 5 milligrams twice a day, and that's continued for as long as you're on the medication. For left ventricular thrombus, which is more of an off-label use for this medication, you'll typically see dosing at 5 milligrams twice a day. What's nice about Apixaban is it doesn't cause stomach upset, so you can take it with or without food. And once again, as long as you take it as prescribed, we know that it's going to be working well, and we don't need to check any levels in your blood. Now, with that being said, there is some blood work for this medication. We'll check your kidney function and your liver function at baseline with your normal labs that you get at your outpatient provider's office or when you're in the hospital, just to make sure those organs are working well. And the reason we care about that is Apixaban undergoes metabolism in the liver. And so if your liver isn't working well, you will have an increased exposure to Apixaban and a higher rate of adverse events. Speaking of adverse events, this is a blood thinner, and so we would expect it to thin the blood. So if you're out living your life, walking around, and you maybe accidentally bump up against a fence if you're doing yard work, you might find that you bruise a little bit more easily, or if you have a very slight cut on your skin, it might take longer for that bleeding to stop. That is to be expected and is fairly normal. If you brush your teeth too hard, you might find that your gums bleed more often. Again, that's totally normal. The big things to keep in mind where you might want to let a provider know is if you have blood in your urine or blood in your stool, or if you fall and hit your head. These are more life-threatening emergencies, and we might want you to stop the medication or potentially hold a few doses until we can evaluate you in a monitored setting. The other big thing to think about with Apixaban are drug interactions. There are a variety of over-the-counter meds that also can increase your risk of bleeding. The big culprits are your NSAIDs, your non-steroidal anti-inflammatory drugs, such as ibuprofen, meloxicam, or naproxen. Apixaban has been compared head-to-head against warfarin in a landmark clinical trial called Aristotle. And in this trial, Apixaban was found to have significantly lower rates of a certain type of brain bleed called an intracranial hemorrhage. There also appeared to be a trend toward lower rates of overall bleeding, particularly gastrointestinal bleeding with Apixaban, and perhaps even lower rates of overall death relating to stroke or systemic embolism. So Apixaban is a really safe and effective medication. It works just as well as warfarin and is likely much more well tolerated than the previous version. So if you remember 3 big things from this very brief video today, remember that, number 1, Apixaban is a blood thinner, and it can be used for a variety of indications, including certain types of heart rhythms, venous thromboembolism, and clots in other parts of your body that we are trying to break up and dissolve. Number 2, remember that there is no consistent blood monitoring or blood work monitoring with Apixaban. As long as you take the medication as prescribed, we know it's going to be at an appropriate level in your body and elicit the desired effect that we're looking for. And then third, remember that there are drug interactions with this medication with your typical over-the-counter NSAID products. Using them in combination can increase your risk of bleeding, and so whenever possible, try to find an alternative, such as acetaminophen, which is Tylenol. And with that, that's all I have for today. I'm looking forward to getting back involved with this channel, kind of get it back up and running and have a more consistent schedule. In the meantime, if there are any other medications you want to talk about, if you have any questions about Apixaban in general or anything else that comes to mind, please reach out and let me know. And I'm looking forward to seeing you on the next one. Have a good one. Bye.